So along with the education and training and working in the research realm, and again, working in research means we work with researchers, we work on clinical trials, we sit on important panels and committees all over the country on all levels, federal, state, and local. And in our public policy work, we have been involved in lobbying Congress because we know that we need adequate funding for the right kind of research, and we have to make sure that that funding is then used properly. And so that's the kind of continuous involvement and monitoring and training that we do in terms of public policy. So I can give you an example. We began with understanding that we needed to have a much more innovative and groundbreaking and cutting-edge research structure in this country. And we helped to develop the Department of Defense Breast Cancer Research Program in the early 90s. And that program continues to this day and has really fostered and developed new creative investigator programs, new mechanisms of research, and has resulted in some very interesting and important breakthrough developments. And we have developed that program in such a way that advocates, trained and educated advocates trained through our programs, are sitting on all those committees that make those decisions and are helping to review proposals, scientific proposals, to make sure that the right kinds of questions are being asked. In addition, we are, in terms of our Breast Cancer Deadline 2020, we have a piece of legislation called Accelerating the End of Breast Cancer Act, which is now going through Congress and garnering much support. And it's a way of getting us to leverage and gather all the results of these billions of dollars that have been really invested in the breast cancer enterprise over the last 20 years, and trying to reap the benefits, bring them together, trying to figure out what the best possible pathways are for the most successful research. And we have really focused on two areas of research that we feel will have the greatest impact in knowing how to end breast cancer, and they are preventing the disease from happening in the very first place, and preventing women from dying of the disease by stopping metastasis, which is the cause of over 90% of deaths from breast cancer. So that act would then really pull together in a high-level commission all of the most important work that's going on in the country around those two areas of focus, and make this a streamlined, efficient, and powerful way of realizing our mission. Visit our website, www.breastcancerdeadline2020.org, for more information about Breast Cancer Deadline 2020 of the National Breast Cancer Coalition.
Did you know that not every breast cancer patient needs chemotherapy? In fact, today, there's a way to identify whether or not you'd benefit from that chemotherapy based on the biology of your tumor. To learn more about the Oncotype DX assay and how to discuss the results with your physician, just press this button.